A vaginal wet mount or wet prep, we've already actually done this test, but it's indicated to help diagnose vulvovaginal candidiasis, bacterial vaginosis, and trichomonas vaginalis. And you can see those in the picture. Normal vaginal flora, though, can also be seen, like lactobacilli, Gardnerella, Candida, and Corneobacterium. And you're really looking for, with those, any overgrowth of normal elements or any pathogenic organisms present, as well as correlating with patients' symptoms of infection, inflammation, discharge, odor, or even pruritus. When creating the wet mount, you are going to insert a speculum if you're doing a actual and visualized cervix if you're doing an actual collection yourself. You use a sterile swab to collect vaginal fluid. You then place the swab in a test tube with about half a mil of saline. You'll keep the sample warm at body temperature, and then you'll place a drop of the specimen mixture on the slide cover, and then you'll examine at high power, ideally at 40x, and you'd report the presence of white blood cells, red blood cells, squamous epithelium, like lactobacilli, candida, trick, and clue cells. Normal values are listed here. You can also refer to reference labs. And bacterial vaginosis is the most common cause of vaginitis in premenopausal women, and it really represents a complex change in vaginal flora. It has been recently classified as an STI, so we do now treat and then co-treat the partner. But it can just be also due to a shift in an individual's own flora. You'll see a decrease in lactobacilli and an increase in the bacteria Gardnerella vaginalis. You also could see an increase in Mycoplasma hominis, anaerobic G. rods, and Peptostreptococci. The AMSL criteria help with diagnosing bacterial vaginosis, and it is the homogeneous gray-white discharge, a vaginal pH that's elevated above 4.5, a positive whiff test with KOH, and clue cells on wet mount. The first three can also overlap with trick, being clue cells are going to be the most reliable predictor of bacterial vaginosis. For a whiff test evaluation, you drop a specimen mixture on a glass slide, add one drop 10% KOH, and you waft air towards your nose. Both Gardnerella and Trick produce amines that will volatilize with KOH, and they'll make a fishy odor present. Then you can apply a cover strip and examine for bacteria that are streaming off of squamous epithelial cells, which can help confirm BV. And you can also look for budding yeast and pseudohyphae that could be obscured. Candida is about a third of vaginitis cases, and up to 75% of premenopausal women have at least one candidal episode. It is rare before menarche, but 50% of people will have one by age 25. It's less common in postmenopausal individuals unless estrogen is being taken. You can see vulvar vaginal pruritus, burning during voiding externally, irritation, soreness, or dyspareunia, and white clumpy discharge. The pH for a yeast infection is between 4 and 4.5 which is normal. You'll see yeast buds or spores or pseudohyphae. The KOH prep will destroy cellular elements, and it can help actually facilitate recognition of budding yeast or hyphae. And it's negative in up to 50% of culture-proven candidal infections, so it's important to note. Trick is the third most common STI, and it's up to 50% of people with trick are asymptomatic. You'll see potentially copious green discharge and a strawberry bright red cervix. The sequelae could be an increased pelvic inflammatory disease, infertility, post-surgical birth infections, HIV transmission, and even preterm birth. And microscopically wise, a saline wet mount is going to be the best bet to see it, but still specificity and sensitivity is relatively low in females and male individuals. On PAP, the sensitivity is low, but specificity is higher, but it is a low positive predictive value in the population. And it's hard to see because trick is mobile and it dies off if you don't keep it warm and look at the sample really quickly after collection. So what are our key points? Clue cells are epithelial cells that have greater than 75% of bacteria, typically Gardnerella. You will not see abnormal numbers of white blood cells with clues for BV. A positive whiff test, when you add KOH, it will liberate amines, and you can see a fishy odor, smell a fishy odor, with Gardnerella and Trick. Trick must be actively motile in fresh samples to diagnose. And Candida, you can see single budding or pseudohyphae yeast. and that can be seen in either a saline or a KOH sample. And this is kind of a nice, helpful chart to help differentiate different types of vaginitis, depending on what you're seeing, kind of different tests that you're experiencing. That's the end of this lecture. We just plowed through microbiology. When we come back, we will be starting to look at other aspects of our lab testing and what we can continue to do.